Okay. Thank you, Donna, for that really nice presentation. It's the first time I've heard nimble and NIAID mentioned in the same sentence, but anyway, great. It's good. Just a comment. I mean, I think one of the things that we really have to be appreciative of is how supportive NIAID has been of us, and having really program officers that advocate for us, as Donna and Beiying have done, is really just wonderful. So we're very thankful for them. Next presentation is going to be Luis Ostrowski. Is Meghan going to help you with this? Or is this just going to be you? Okay. So Meghan Lyman at CDC and Luis Ostrowski are going to talk about the MSGERC CDC collaboration. There's lots to talk about here. Thanks.
Thank you very much, Pete. And because the title of this talk is Collaboration, we decided to collaborate on the talk. So I'm glad to share the podium today with Meghan, who's one of the officers at the CDC. And Pete and John asked us to give an update on what have we been doing with the CDC and where we think we should be going. So as in many things, in the beginning there was chaos. Controlled chaos. You know, we were working together very informally. There was always some representation by the CDC in MSG activities, and this ranged from just being members of MSG to now having a non-voting board member who's Tom Chiller. We've always kind of helped around in projects informally. Very famously, you know, I remember Tom bringing us, a few of us, to Atlanta to do a peer review of the Candida surveillance program. And when we were doing this peer review, Tom asked, hey guys, have you heard about this Candida auris thing? And we started to chat about Candida auris. Sean was there. And out of that conversation came the CDC Candida auris guidelines, from diagnosis to management to infection control. So again, all very informal. Transnet is kind of the poster child of the first formal collaboration between CDC and MSG. As all of you are aware, this was a very major surveillance program for IFIs in transplant patients, co-funded by the CDC and private industry with a steering committee. And again, this became the model of what we wanted to be doing. Then, you know, there were occasionally opportunities for funding for meetings or to bring people to meetings, or very scope-limited projects where, you know, Tom needed something done and he would approach us either as individual members of MSG or as the organization. And one of the clearest examples of how we work together is Fungal Disease Awareness Week, where we synergize in bringing information and a lot of excitement to the general ID community and the community at large during this event, which is coming up for the 6th year, I think. So then came the COAG, the Cooperation Agreement. And this is a very interesting story. There was some very, very important advocacy efforts by Dr. Pappas and UAB, and there was vision and leadership by Tom Chiller, and this, in the right political climate and with the right people on the table, resulted in an incredible accomplishment, which is that the MSG is named in the federal budget. There's earmarked money in the federal budget for one organization, which is the Mycosis Study Group. And again, we have to thank Pete and Tom for making this happen. And this also sort of gelled with finding an educational partner, Terra Nova, that allows us to really bring this program forward. This is a $1 million program that is designed to educate people and do advocacy about fungal infections, excludes clinical trial work for now. But this was a pivotal moment in the history of collaboration between our organization and CDC. And then COVID-19 came, and it didn't really affect us in the way you would have predicted, where, you know, all the funding was going to be pulled from mycology. It actually gelled things again to rapidly accelerate our collaboration. And I'm going to turn it over to Meghan so she can give you some examples of what we did with COVID, fungal infections, and the COAG.
Thanks. And I am part of the mycotic diseases branch, and I've been working closely with MSG. I spend most of my time working on Candida and Candida auris, but it's been nice to be involved in the variety of activities. So I'm going to talk a bit about those. Some of them have been covered or mentioned in other talks, but I think it's really about the experience of how these activities have evolved over the last couple of years. So at the beginning of the COAG, it's right at the beginning of COVID, and obviously the most important issues were being heavily influenced by COVID. And the first one that comes to mind, as Luis said, we weren't sure how COVID was going to impact fungal diseases all of the ways, but the first one that came to mind was COVID-associated pulmonary aspergillosis. And that's something that I think a lot of experts, fungal experts, really brought to the forefront, but it wasn't something that there was a lot of awareness beyond that. So it was a great opportunity for MSG and CDC to work together to fill this gap. So these are a few of the activities that were started at the beginning and really started with CAPA. So a website was developed focusing on COVID-associated fungal infections to really provide resources, but a lot of the early resources were about CAPA. And the first one was a care step pathway, which is an educational tool to provide information and guidance on who to test, how to manage these patients in a really digestible format for frontline staff. And you can learn more about it outside. I think there's a display of the care step pathway. And there's a publication on the development and use of that tool as well that was led by Carolyn. And there have been other resources that have been added, patient interviews, again, last night discussing the benefit of hearing the patient's story and caregivers' experience and providing resources for that. But what's really been amazing about this collaboration is its ability to be flexible and really, meet the needs that arise and emerge as we've gone through the last couple of years, especially related to COVID. So after CAPA, the next topics of interest that came up were other COVID-associated fungal diseases. Cases of mucormycosis were being reported, and I think everyone's aware of all the media coverage of the black fungus in India. There are also cases of Cryptococcus and cocci, a lot of which were reported by MSG members and the patients that they follow. I know Pete mentioned some last night, and I think that this is something that, isn't being covered in the media, so it's good that there's a network of people sharing these experiences. So with this information, there are obviously new opportunities to add more information and resources to the educational website, more interviews, specifically one about COVID-associated crypto, a mucormycosis infographic. Again, because of all of the media coverage, there was a lot of misinformation. So it was great to have something for the public that they could easily understand. And with the color coding, again, a lot of misinformation, and people were really latching on to the black fungus. And then we'd hear about yellow and green. So it was a great resource, and we've gotten great feedback, especially from international partners who've taken that information and translated it and used it. A publication, again, not just covering CAPA, but the wide variety of COVID-associated invasive fungal infections led by John Badley. And then, as Alon mentioned, multiple Twitter open mics, and I think that there has been amazing participation, especially for this mucormycosis one, internationally. So it's been a really positive experience. And then, an interest that I think has developed in time, but also related to COVID, is the idea of health disparities and risk factors for these COVID-associated fungal infections. There's a whole video series available, and there's also ongoing data analyses to really understand these better so that we can respond and address them. A lot of this is to expand the education and knowledge about these beyond fungal experts and even infectious disease physicians. So the team has been really good about creating CME to really push that to new audiences. And you can see by the participation that it's very high, and I think this is something we'll continue to do to reach new audiences. So after the COVID-associated fungal diseases, COVID became a little more routine, part of our everyday. We were able to shift and start thinking about other fungal needs. And this says non-COVID fungal topics, but everything has a slant from COVID these days. So for invasive candidiasis, we were seeing more reports about an increase in candidemia and invasive candidiasis, maybe because of the strain on the healthcare system. So it was seeming like a worse problem. We also had time to do some analyses of our own surveillance at CDC, so we were seeing increases in cases. We also had seen that there were gaps that were long existing. Jeremy Gold did one analysis looking at diagnosis and treatment and how, the recommendations were not being followed, so it just provided more opportunities for education. Resistant dermatophytes is something that we have been hearing more and more about and engaging with international partners and domestic partners, and is an issue that has just really been driven home to us. And that's something that we were able to, from the CDC perspective, talk to MSG and get put in touch with other experts and just come together to figure out how to address this. Endemic mycoses. Underdiagnosis is a huge issue, but I think also during COVID, where everything was COVID until proven otherwise, there's another opportunity for these fungal diseases to be underdiagnosed. Antifungal resistance, a big concern, growing, and with the increased use of antifungals during COVID, that just makes our concern even greater. And then cryptococcal disease, we've heard about a lot of advances recently, so I think that was another opportunity to really spread the word about these developments. So moving from the COVID-specific website, a fungus education hub was developed, a new website that could host these more general resources. Luis and I worked together with Pete and the Terra Nova team and MSG to create an invasive candidiasis infographic, really trying to highlight the really important points for a general audience that we think are being missed. The team has also been working on an endemics algorithm. Some of you may have reviewed it, but the goal is really to try and make this information available to general practitioners, internal medicine, primary care, who may be interacting with these patients and missing diagnosis opportunities. And again, another way to do that is through CME. And there have been also webinars and resources focused on individual audiences. I know one in particular is webinars for a Latin American audience. So I think that will continue to expand the scope of this work. And again, the webinar series, which cover all of these topics, have good attendance and will continue. So I'll give it back to Luis.
So to finish up, we want to give you some numbers related to the COAG. And this can be found in the poster outside as well. So you can see that we've been very, very busy. This is really the product of two groups that have a drive to do this, and catalysts like Terra Nova, like Caroline. And so we've launched 2 websites. We have 2 peer-reviewed publications educating the medical community about these issues. 4 algorithms and pathways, which we find very useful for people to be using in the wards and when teaching. Another thing we were thinking was very, very important is advocacy, and we're starting to engage patients, and we're starting to bring these horrible stories of people affected and how their lives change due to fungal infection. Another really interesting thing, and this is again coming from our collaboration with Terra Nova, where they have experience in sort of caregiver care. And so we've been doing a lot of work with caregiver resources, phases of fungal infection, 2 CME activities, 7 infographics. The Candida ones are really, really fun. And for the first time, we're coupling the infographics with a podcast, which is expected to launch very soon. It's really fun to listen to. It's Pete and I pretty much doing the Saturday Night Live skit, the NPR ladies, sort of talking about the delicious graphics. And we have, very importantly, tried to do outreach to international partners. The Mucor Twitter chat was really, really important. This color coding sort of education. And we did 2 webinars with Latin America where people would bring their cases and talk to us and have a very interactive discussion again. We're starting to work on the healthcare disparities, which is very important work. So what's next for the COAG? More education. And a very interesting thing that's happening with CDC is CDC, Tom specifically, is putting out BAAs, broad agency announcements, with specific projects that are appropriate to us. So far, a few of our members have bidden and taken these BAAs, but we should, as an organization, be taking this and rolling this out. So these are very unique funding opportunities to do joint work with our mutual interest. Next up is really a lot more focus on the endemics. We do need to tackle resistance. There's increasing resistance with Aspergillus, Candida glabrata, resistant to echinocandins, the new parapsilosis resistant to fluconazole. So there's a lot of work in resistance to be done. And of course, surveillance. And there's going to be some important funding mechanisms for surveillance, including Tom and I's favorite topic, which is poop water. So we need to start looking at wastewater as a mechanism for surveillance. But the most important thing about this talk is, what do you want to do? So we really wanted to yield the rest of our time to add more time for discussion, to hear from our members, how can we collaborate with CDC in a more meaningful fashion. Thank you very much.